acknowledge the traditional and cultural custodians of the lands, waters and seas across Australia, pay our respects to elders past and present, and recognise the role of current and emerging leaders in shaping a better health system and achieving equity outcomes. Today, I'd like to introduce Haylene Grogan, a Yalanji and Tagalaka woman, our Chief Aboriginal and Torres Strait Islander Health Officer and the Deputy Director General, Aboriginal and Torres Strait Islander Health Division for Queensland Health. And today she's going to talk with us about how we put the voices of our First Nations people at the table and how we help on this journey to a health equity outcome in Queensland. Hello, Haylene, and thank you for taking the time to be with us today.
Thank you, Sarah. It's a nice acknowledgement.
If you don't mind, we're going to ask a few questions because since your time with Queensland Health, you've been stewarding the health equity agenda, and particularly you released a discussion paper. Would you mind talking with us about why this was so important for you in this role and what you hope to achieve from it?
Okay. Never know what I'm going to say when you ask me these questions. The opportunity can I go back a little bit? I was here 10 years ago, leading the development of making tracks towards health equity policy framework, and at the same time we led the development of an Aboriginal, Torres Strait Islander cultural capability framework. Since I've been away from the Department of Health in about a 10-year time frame, a review of barriers to institutional racism was undertaken, and in response to that report, which actually identified many shortcomings by the Queensland Health Department, the then Minister for Health, Stephen Miles, established my position and then introduced an amendment to the legislation of the Hospital and Health Board Act to introduce a health equity into legislation. And so I had the privilege of coming and leading this piece of work. But I think at a personal level, the reason why I'm even working in government and the reason why I'm even I'm so overwhelmed at the opportunity that I have to lead a piece of work that's going to change our people's lives is that for me personally, my father and his siblings, and I was leaning over to grab my these out of my bag because I carry them around with me. These are the original certificate of exemptions. One's my dad's and one's my auntie, his sister. Those certificates of exemptions were required so that my father and his family could enter society. They were actually under the Protection Act, and they couldn't actually leave the mission that they were in unless they had one of these with them. So the importance of having legislation that enables our people to have a say in health services, that law is actually going to make a difference for me personally, is the reason why I even became a bureaucrat, was that I wanted to have a role in changing the very policies and laws that have controlled our people's lives in the past. And health equity legislation requires a co-design with Aboriginal people. So for me personally, that is why it's so important. And not that I think the then Minister for Health even knew some of this personal journey for some of us, because my story's similar to many others in Queensland, but I get the privilege of coming back and leading a piece of legislation that is going to enable our people to have a say in their health care.
So for those of us, Haylene, who are listening to words like health equity and wondering, what does that mean at a practical level to you, and particularly in the Queensland context?
Yeah, not sure how to answer that question properly, but in terms of equity, I mean, a lot of people may get confused with equal being equity. You know, you give someone $5, you also got to give them $5. But for me, it's equity of access and outcomes. And if you think about, I've used this analogy before, certainly when we're presenting the discussion paper, we've got a little diagram of looking over a fence, but I might describe it a little bit different. If someone's down a 10-foot hole and another person's down a 12-foot hole, you can't give a 10-foot rope and expect the person down the 12-foot hole to get out of that hole. They actually need different sizes of rope to get out of the hole because of the circumstance they're in. And that's exactly what equity is about. It's actually attributing equitably so you can get the same outcomes, but sometimes someone might need a 12-foot rope rather than 10-foot rope. In the discussion paper, we've used we've used the analogy of looking over a fence and the two people needing different, one person's really tall and can see over the fence and the other one needs a stool to stand on. And in fact, the little diagram takes you through a process of where you get to where the fence isn't there, and it's, there's no need for any of those adjustments. I don't know if that explains it, but just to explain that, I think people get mixed up with equality and equity, and equity is about ensuring that the right attribution of resources gets allocated to get the same outcomes, and that require. And in health system, that's pretty big because the health system is huge. It's made up of many parts, and we've got a fair bit of work to do to mobilise the health system. We're not starting from scratch though. We've got a good foundation, but if we can see that our mob, wherever they are in Queensland, no matter where they live and where they come from, that they are getting the same access to health and the same outcomes in health, which is a long journey, and we're now embarking on the next 10-year journey for closing the gap. We know we've achieved it, and one of the big elements of achieving that is written in our regulation. I'm going a little bit all over the place here, is about eliminating racism, because for the first time ever, not only does that regulation that I referred to before require a co-design process, it requires every HHS to have a health equity strategy co-designed with Aboriginal people, in particular the community controlled health sector. It requires every hospital and health service to have a workforce commensurate to the First Nation population that they serve at every category and every level of the health workforce. And importantly, it says we have to eliminate racism, and that is the first written into law. I think I went a bit off the question there because I'm a bit passionate about subjects. I probably could just talk and answer all the questions.
No, one of the things in moving along on this journey, though, and a critical foundation was actually the appointment of Aboriginal and Torres Strait Islander health executives in our health services across Queensland. That started back in 2018. Why do you see that being so important, and what are the changes that you've seen because those voices are now sitting around, not just within the systems, but at the executive level, which is clearly where those decisions and that leadership needs to stem from?
Yes, and certainly, having my position is a very useful, it's a big step in the right direction, not just about me, but this position is a big step in the right direction for the future of that leadership capability. Look, I led one of the first First Nations workforce strategies back in 1998. So we've been on this journey a bit longer than 2018. It's taken a while to get there. And in 1998, the strategy that we were, what we were advocating was to have Aboriginal people across the system and I used to say it, and I still say it, from gardeners to surgeons. It's incredibly important to have not only Aboriginal people, and often they're at the lower levels, but I signal the significance of a gardener in a healthcare system as well. And we want our people across the system. We want a voice in the whole system. We want a better integrated system. By having Aboriginal people across the system, you're going to get a voice in the system anyway, and you're going to get an organisation that has cultural capability because you've got Aboriginal people working across the whole of the organisation. Having Aboriginal people at the leadership positions, like they have started to embark on, and in fact since 2008, even since I've been back, there's been at least 3 or 4 more positions put in place, is unless you're a part of the senior decision making where the leadership makes most of them commitments to what an organisation has to do, unless we have Aboriginal people in those senior positions, sometimes those changes take longer to come. But I will be honest that I will be honest to say, while we're here and in those senior positions, and we need to have that executive capability, I call it system leadership, system capability. We need to have every HHS. We need to ensure that those positions, and some aren't quite there yet, and there's a little bit of a discrepancy between the HHSs, but what I'm hoping is that we can have positions that are commensurate to other leaders in the HHSs. I forgot to mention that the amendment to the regulation not only gives a commitment to workforce commensurate to the First Nations population they serve, the second, and co-designing health equity strategies, the second big amendment to the legislation was requiring Aboriginal Torres Strait member, at least one Aboriginal and or Torres Strait persons on every hospital and health board, which again gives system capability, because not only have we got senior leadership, which is really important, that makes the change happen, we're now going to be having First Nations people sitting on the hospital boards having a say. So we're starting a wave, I suppose, of system capability that needs to be built on. Not dismissing the importance of our Aboriginal and Torres Strait health workers and health practitioners in the role that they play in health, which are, unique cultural brokers in a system that is going to be important I'm going to go off on a bit of a tangent here, going to be important because this government's embarking on a treaty agenda, and Queensland government itself more broadly has to have cultural capability to be able to embark on an agenda as big as treaty, and health is leading the way at the moment in terms of where we're at as one of the big portfolio in government here. And I could keep going on to answer one question.
But what you're talking to is ultimately there has to be some accountability, and that's being set up either through the legislation and the regulation, but also through your health equity frameworks, which is where that translates down to the regional, local level.
Yes.
What's the status of that framework, Haylene, practical sense?
Yeah, so what we did was, we embarked on, given that the requirement of HHS was to co-design the health equity strategies, we embarked on a process of co-designing the discussion paper and co-authoring a discussion paper with the Queensland Aboriginal and Health Council, which is the peak body for the Aboriginal and Torres Strait community controlled health sector. And we're really fortunate in health that we've got a very capable sector that's been growing and building in terms of their capability over a 40-year journey. Back in the 1980s, when the National Aboriginal Health Strategy in 1989 was launched, which was informed by a group of Aboriginal health leaders, the journey for our people's role in the health system started before that, but from a policy and government perspective, it was a significant milestone in the launch of the National Aboriginal Health Strategy. I'm reflecting on the past, because if it wasn't for the past, we probably wouldn't be here in terms of what we're building on today. That National Aboriginal Health Strategy was landmark in terms of what our people what role they could play in the health system. At the time, in the early 90s, following that strategy being established, the Aboriginal and Torres Strait Commission was established, and they worked out very quickly that the money that they got for health, that they didn't have the capability to allocate that funding adequately enough to make a difference. So they handed the health money back to mainstream health under some really strong conditions that we would work with the community control sector, we would share data, and we would do joint planning. Now, some of those things are still important today, and the reason why I'm mentioning this history is that that community controlled health sector has been well supported by investment from the Commonwealth and state and territory governments, but mostly the Commonwealth, of establishing in the primary healthcare system Aboriginal and community controlled health organisations across the country. In Queensland, we've got really strong leadership in the community control sector, and we've got a peak body that represents them all, that has got really good, strong leadership. And the other thing that we're building on in Queensland is that we were the first jurisdiction from a government perspective that developed and progressed the 1994 Aboriginal health policy. So we come from a really good base. So we embarked with Quake on a co-design, co-author this discussion paper to socialise across Queensland what health equity is going to mean for us. So they went out and they're just producing those reports as we speak, and also to get input into what we think the health framework needs to look like, that is going to guide the development of the health strategy, the equity strategies by the HHSs. The timing of that has taken us up till now, and just the reports being written, and we're about to take back for government consideration the next steps. So that will be the outcome of the consultation, what we heard, and it'll also be proposing a health policy framework. It also will be flagging that we're working, and we're starting to work on a toolkit to assist the HHSs in their equity strategies. For those, if you're familiar with the reconciliation process, the Reconciliation Australia has developed, 4 categories, I can't remember, and they're like guides that guide organisations through a reconciliation process. In essential, we're developing a toolkit that's going to guide the HHSs to co-design, and we've worked with the community control sector. So that discussion paper was launched in March. We've gone out and consulted. We're about to finalise the report. The government election commitment, I'm anticipating your other questions there. The government election commitment was that they had to have the health equity strategies by July this year, which we knew at the beginning of the year when the government returned after the election, that was going to be a time frame that was impossible to keep. So we negotiated with the new Minister for Health, to agree that the hospital and health service be able to develop those health equity strategies 12 months from the commencement of the Act. So while it was introduced in November, the amendment in 2019, it passed in August 2020. The Act, the regulation, we worked on the regulation, and the regulation was passed in April this year, on the 30th of April, or 29th of April, sorry. So that commenced the enactment of the amendment. So the Act is now commenced, effective 30th of April. So HHS now have until 30th of April to co-design their health equity strategies and produce them. And we're going to provide them with a framework, which will be a policy context, as well as a toolkit to actually support that process. So I think I've tried to answer some of those other questions that you were going to ask me.
No, you have. You've given us a good sense around what the steps are, but also the timeframes that now the health systems themselves are dealing. Yeah. I mean, what all that leads to is a lot of work in a short period of time, Haylene.
Exactly.
And you've achieved a lot, including navigating a pandemic just off to the side, supporting truthfully some of our most vulnerable communities. Yeah. Across Queensland. I'm interested in perhaps changing tact a little bit. Just what has your time in this role then, and all of that leadership across government, but also with community and with a global challenge, what has it taught you about leadership?
Oh, well, leadership is incredibly important. I suppose that's almost you can't do anything without the proper committed leadership. And in terms, if I do talk about our response to the COVID-19 pandemic, if it wasn't for the local leadership of most of them, our Aboriginal and Torres mayors in the discrete communities, we would not have prevented COVID from spreading to those communities. But I'm a big one on, leadership on all levels, not just, it's not just the most senior people that are leaders. The leaders come in all sorts of forms, and it's really important. And I think too, in the pandemic, and when it all commenced last year, I think the leadership is important, giving people hope in terms of that there's a direction, and we're actually knowing what we're doing and where we're going. And I think that's also really important. For me, in addition to the leadership, I have the 3 R's. Relationships is number one for me. You've got to establish really good relationships to be effective across to be effective, you've got to have good relationships at all levels. You've got to have take responsibility, and leaders have to take responsibility and know that they're going to be the accountable person by taking responsibility. But it's also about self-responsibility, and the same. And then the last R I have is respect, and that's also about demonstrating respect for others, but also your own self-respect. So that's my sort of basis for what I think good leadership has to have. We could not have managed the COVID pandemic response, and we've still got work to do because we've got a vaccination challenge now with our First Nations people. We could not have managed across the country, I suppose. For the first time, Aboriginal people are the lowest numbers in the COVID-19 in terms of cases, which is really positive for us. But we could not have done that without working with our community control sector partners. We could not have done that without working with our mainstream partners and ensuring that our responsiveness catered for First Nations communities. And we could not have done that, I'll go back to my opening statement, without the local leadership and support. And to do that, we had to establish a really strong communications and engagement process supported by lots of planning. But there was one part there where we were talking to the mayors for all the Aboriginal and discrete communities on a daily basis for two almost 3 weeks, including a Saturday and Sunday. So we were having regular teleconferences with them to ensure that we were supporting them with what they were doing. And some of those communities, Yarrabah, for example, and Cherbourg, particularly Yarrabah, they were shut down for 12 weeks without allowing to move out of those communities because the biosecurity restrictions were so strong. Anyway, I could start another journey of conversation there.
No, absolutely, and it is worthy of giving respect to those local leaders, because the other piece in that was that many of them had just been elected newly as mayors. Yes. So for most of those discrete communities, they were not only stepping into a pandemic, but stepping up for the first time into a community leadership role. So
absolutely,
phenomenal job.
They did a phenomenal job. Now we've got to work with them to ensure we get the remove the hesitancy of the vaccination, and that's the next campaign we're about to embark on.
That's right. The final question, really, Haylene, that I have for you is, and you touched on it in your framework ambition, which is about having representation of Aboriginal and Torres Strait Islander people across organisations. But importantly, and this is more broadly speaking outside of health, having them in leadership and executive roles. What can we do as organisations to encourage and support Aboriginal and Torres Strait Islander peoples into leadership and those executive level positions?
Yeah. Well, and I think active recruitment into targeting First Nations. There are and that the biggest thing I think for an organisation, not only, and the leader has to be committed to wanting to have that senior type capability, and all the HHSs within health are starting to stand up and do that. We are boasting in Queensland, many of the agencies are establishing similar type leadership positions. So I think it's having a commitment to have them. A lot of them often look to, and understandably look to, having an identified targeted position, which means then it is dedicated and quarantined for an Aboriginal Torres Strait Islander person. That's always useful, but equally as useful as actually, having strategies in place that would attract Aboriginal people in other leadership positions as well, because it'd be great if we have, I think Chris Sarah's, not our first, but having Chris Sarah as our Director General of a head of Aboriginal Affairs Department. Aboriginal Affairs Department is pretty important. Kerry Tim was there before, but I don't know whether it was a department at the time when she was there, but having our people in those type of senior positions is equally as important. It brings, the other thing I was going to say in terms of what organisations can do is have a place or an organisation, an agency that is encouraging of including Aboriginal people into their workplace, because that diversity and inclusion is really important. I'm going to call it culture capability. We need organisations to be on a place that, I'd like to say, this blackfellas want to go and work.
Yeah.
And we need to then do a whole heap of strategies around culture capability. But one of the simplest things to do to get culture capability is to have Aboriginal people employed throughout the organisation, and that will happen by almost default. So that's why I'm big on those three things about having our people in the system, a voice in the system, and better integrated system in terms of patient care. But people and voice in the system are really important, and it's the foundation of treaty is having a voice to Parliament. So a lot of the work we're doing in health is definitely going to assist with the bigger treaty agenda. And, my counterparts across in Aboriginal Affairs are leading, some community-driven local thriving communities, while our co-design process is truly well aligned, because we're going to be working with communities to support an agenda like local thriving communities where they get local decision making. Mm-hmm. And it went off the track there because you're talking about the importance of the leadership in organisations. I can't stress it enough.
No, that ability to have the voice at a local, at the local level, making those decisions. And in truth, you can't be what you can't see. So you that visual and
I'll remember that.
Yeah. And that cultural capability that really does then enrich not just your own organisation, but the strategies that you then use to deploy whatever your service profile is, and hopefully translate into giving good care to our people, because of the way that we run our organisation. That's the ultimate, and that's why I talk about really good, strong, integrated care, because essentially we want a patient-centric approach to the way we support our First Nations access to healthcare. And if you've got culturally capable organisation, that should translate into good, culturally appropriate healthcare, and hopefully improved health outcomes.
Well,
hey, thank you for your time. Is there anything else you'd like to say to us, even if it's about the beautiful backdrop that you have behind you?
Thank you. And I probably will close by acknowledging, and I didn't do it at the beginning, but I will close by saying thank you for that acknowledgement of the role of our First Nations people as traditional custodians of the lands, water and sea that we play. But I always take an opportunity when I'm paying my respect as elders past to thank my elders. I sort of thank them by recognising them in one of my answers. But if it wasn't for them, I wouldn't be here in this position in terms of the foundation that they laid. And just wanted to say that. And the artwork proudly is my nephew's daughter, the artwork, and she won a prize with it in North Queensland. Jasmine Grogan, I should name her because I'm proudly showing it off. And I don't know that I've even met Jasmine yet, so I'm going to be very proud when I meet her. And maybe the last thing I might say is make sure that you all get vaccinated, which is off topic.
No, very important topic. Thank you, Haylene Grogan. It has been an absolute pleasure, and thank you for your heartfelt, personal, but also incredibly driven and professional insights into this very important role that you're playing for the Queensland Government and for Aboriginal and Torres Strait Islander people across this state. Thank you.
Thank you, Sarah. I want to do more.